we do have a little bit of a family medical situation, so at some point during the meeting, I may need to finish the meeting remotely. Just a heads up.
All right.
Hang on a second, Tony. Hang on.
Yeah.
I gotta get Tasha back situated as host now that she's here.
Yeah. And we got to restart
She's
the
got to
recording.
start the recording. So give
Start
us
the
1
recording,
second.
and
Yep.
and we just want to make sure that IT has restarted the broadcast. Dan, if you can chime in and let us know when you've restarted the streaming on YouTube.
And Tasha, you're the host again. You should be all set.
Okay. Oh, wait.
Looks like we're back up streaming, says the chat.
Okay. I don't have me as the host. It doesn't give me the recording option.
Were you the host or was administrator the host?
Administrator.
So you were currently the host, Tasha. You need to switch it over to administrator.
Oh, from my phone.
Oh, I did it wrong.
Oh, okay. I'll just do it.
Administrator is the host now.
Yes.
Recording in progress.
Okay, we're all set.
Okay, good. All right. We have concluded the executive session, and the next item on the agenda is reports and comments of council members. I will go quickly. Many of you have seen the obituary for Roberta Smith, who died in the past couple of weeks at over 100 years old. You may remember that we celebrated her term of office as town historian at her 100th birthday last summer. Ms. Smith was a wonderful member of our community, and her loss will be certainly felt as time goes on. I will say that we've begun to look for a different town historian, and we're waiting for a response from the Historical Society about the possibility. I also wanted to comment that I was at the CCM convention. One of the really good news about the CCM convention is that safety protocols were very thorough. And in the nearly 2 weeks since the convention was held, there have been no reports of disease of COVID spread from any of the nearly 1,000 participants. About 450 municipal officials and a whole slew of vendors and other kinds of professionals were there. So it was a successful conference, and we attended some very valuable sessions. It was very interesting to hear David Lehman talk about economic development and the plans for the state. And obviously the focus was not on the little towns like ours, but on other efforts around the state. But we do have his attention. And I was also able to thank him for his support during our discussions with the Board of Trustees at the University of Connecticut. So, and he was glad to hear that. So, those are my comments. Do other members of the council have comments, reports, or comments? Mr. Coleman, you're muted.
I'm sorry to announce that we lost a very valued member of our business community. Andy Duvall, 73 years old, died last month. He was the owner of D&D Auto. He was an expert. He was an expert in Volkswagen repairs. He'd been working on Volkswagens since 1970. He started his business at 1733 Stores Road in 2006. He had a huge following of Mansfield residents and other surrounding communities. I had a fleet of Volkswagens with my family. I had 4 Volkswagens. Andy serviced all my Volkswagens. He was a mechanical genius, and he'll be sorely missed.
Thank you for that. It's also a small business that we will lose in town because it's unlikely that that business will continue. Anybody else? All right, the next item is the consent agenda. The consent agenda includes, Mr. Shuren?
Oh, yeah, I'm sorry, I didn't mean to interrupt. Just go ahead.
Okay, includes the approval of minutes, financial statements, an agreement between the Regional District 19 and school administrators, and the grant application which Ms. Freed spoke about, or which Dr. Freed spoke about earlier. Is there a motion, Mr. Shuren?
May I just ask a question before a motion? As I understand it, the agreement between the school administrators and Region 19, it says in our material, we have 2 choices. 1, to let it just pass without any action, or 2, to reject. I certainly don't want to reject. If we include this in the consent agenda, are we taking action?
Mr. Shaken.
Ron, I think you're misreading our options. We can communicate our third option is to communicate our approval of the board of the agreement tonight. I don't think we have the third
option. So
I don't think we have an official option to approve it. We only have an option to reject if we wished, but we have often communicated our approval to the boards for these agreements. And I think that's what's before us tonight. Is that correct?
Well, if you look at the agenda.
That's accurate.
Yeah. However, if I'm reading correctly, not to make too much of it, page 105, it just says there are the 2 options. So if we have that third option, perhaps we should somehow state that.
We could always say we decline to take either of the 2.
That's why I'm saying if it's in the agenda, it's then consent.
Yeah, I would say we have no objection to the adoption of this agreement. Is there? There certainly isn't. The only issue is the wording of the resolution.
Yeah.
Yeah, if I may, Madam Mayor, I think, and I could be wrong, I asked Tasha to weigh in perhaps, but I think the original version of the packet you received actually didn't have a motion. And that was by design. Didn't seem to me that given the options that action was needed. I don't think, if you vote to affirm, I don't think, you've done something really other than exercise number 1. You just took action you didn't have to. But I think there was some staff-to-staff communication today that somebody might have thought that there was an intention to include a motion, because I think perhaps a previous iteration of this agreement, there was a motion to approve put on by that era's town manager. In my opinion, there's no action needed. It just kind of got added to, I think, in our revised agenda late in the game. So
it doesn't hurt anything for us to indicate our support for it, which is why it's on the consent agenda. Yeah. So rather than take it, I understand the difficulty, Mr. Shuren, but rather than take it off the agenda and have a further discussion, can we just leave it there and vote for it?
Fine with me.
Okie doke. So is there a motion to adopt the consent agenda?
So moved.
Moved by Mr. Shaken, seconded by Mr. Bruder. Further discussion? Is there anybody opposed to the consent agenda? Is there anybody who wishes to abstain from the consent agenda? Then I rule it's been adopted unanimously. Thank you, and thank you, Dr. Freed, for the work you and the commission have done on this. I think there may have to be some additional negotiation about the actual administration if we receive the money. I mean, I think the town has to be the receiver rather than a commission or committee member. So we'll have to work that out.
Yeah, I think that we started from absolutely no knowledge of what to do, and we've made a lot of progress, but we're not done yet. I also received a communication from Debbie Irving's assistant today, suggesting other ways that we could raise money. So I'm going to need some support with understanding how we handle acquisition of funds in any form. And who do I talk to?
You can talk directly with my office.
Ryan? Okay, thank you very much.
Okay, thank you.
Yep.
All right, on to COVID. Is Mr. Miller with us? There he is. Welcome, Rob.
Hello, Madam Mayor and council members. I have a few items to share with you tonight. Starting off with the data, as I always do. I think it's pretty well known that we're currently experiencing a material increase in the prevalence of cases within our communities, and the health district, and Mansfield's no exception. I can tell you that as of the end of last week, the town of Mansfield was considered in the red, as is 95% of the towns in the state of Connecticut. The number is 20.5 cases per 100,000. The CDC measures the risk of transmission and puts it in the high status within the community. Their number is 369 cases per 100,000. That's as of today. They do daily recalculations. Recall that the threshold for pushing you into the high category is 100 cases. So Mansfield is let me correct that. I'm talking about the Tolland County level risk of transmission, not the town of Mansfield. But I think it's also important to note that that all the counties within the state of Connecticut are also significantly higher than that 100 cases per 100,000. In terms of just basic counts, there's been 73 cases in the town of Mansfield in the past 2 weeks as of December 4th. And of those 73 cases, 13 of them were University of Connecticut students. I know there's been some questions about UConn, and I did speak with Dr. Ayer, Director of Medicine at Student Health and Wellness today, and she did report that there are, as for the past 10 days, there's been 53 positive cases among the student body. That includes both on and off campus. I think it's important to note that those numbers won't correspond directly with our numbers, one, because the time period is different, and also that includes self-reported cases, which in some cases are doing home tests, whereas our report is just laboratory confirmed tests. And that number also includes cases that live outside the town of Mansfield. So it's hard to say for sure, without drilling into the data of those 53 cases, how many of the off-campus cases are in Mansfield. I can tell you that 22 of those 53 cases are residential on-campus cases. They currently have 9 individuals in isolation. And as everybody's probably aware, as most of the people are aware in this meeting anyway, classes ended last week, and finals will end, I believe, the 16th of this week. I think the other important data I think that's important to point out is that the impact in some of our age groups has been changing over time. For the first with the exception of the last 90 days of the pandemic, about 3% of the positive cases were among kids ages 0 to 5. And 12%, 3%, 0 to 5, 8% of kids 6 to 15, starting way back March 2020. Now, as compared to the last 90 days of this pandemic, those numbers have changed. For the age group 0 to 5, it's 77% of the cases, and for ages 6 to 15, it's 12% of the cases. So kids are certainly a larger proportion of the cases we're seeing in the health district community over the past 3 months. And then looking at the case counts for the entire health district population, just to give you some perspective. 4 weeks ago, we were looking at 49 cases during the week ending November 13th. For this last week on record, we've jumped up to 222 cases. So that's a material surge in cases that we're currently dealing with. Contact tracing has been extremely challenging to keep up with. And I know that we're working with the schools that they too are challenged with an increase in cases among the student population. So why are we experiencing this current surge? Well, I think it's a number of factors. All are contributing to this situation. For lack of a better term, it's kind of your perfect storm scenario. We're dealing with a population, while a majority of it is vaccinated, many of them were vaccinated over 6 months ago. So certainly there's a waning of immunity, which I think much of the population is experiencing now. The other piece that I think it's important to note is that there is some seasonality to this virus. I think at this point it's safe to say. How big of a factor that plays, it's hard to say, but certainly a piece of that is the fact that because of the cold weather, many individuals are spending more time indoors in confined spaces. And that I think is certainly combined with the notion of COVID fatigue, in which individuals are a little bit more relaxed about how they behave with respect to social distancing, masking, and those factors, I think are all contributing to this current surge that we are now experiencing. I want to talk a little bit about the vaccine campaign and vaccination coverage. The health district has administered over 1,300 doses, pediatric doses, to 5 and 11-year-olds over the past 5 weeks. We continue to have weekly smaller scale pediatric clinics out of the Mansfield Town Hall. We've vaccinated over 12,000 or administered over 12,000 doses to date. The other, in terms of vaccine coverage for the town of Mansfield, I think they're doing reasonably well in comparison to the state of Connecticut. Fully vaccinated population is about 81% compared to 68% for the state of Connecticut. For the kids 5 to 11, we're at about 36% of that age group, which has received their initial dose, compared to the state, which is at 27%. And for 12 to 17-year-olds, you're at 77%. We don't have a comparative figure for the state totals. They're just not tracking the data that way. For some reason, I think it has something to do with the way immunization records are managed in the statewide database. As for boosters, I think there is no data available from the state at the town level. I think even at the state level that's available to local health departments anyway. I do know that the CDC is tracking that figure at the state level, and the state of Connecticut, as of today, is at approximately 22% of individuals who are eligible for the booster have received it, is my understanding. And so certainly there's some room in that department. particularly in light of the current surge that we're experiencing with the waning immunity and, of course, the concerns that are out there regarding the Omicron variant. And so, let's see, I think with that, I'll leave it there, and I'd be glad to answer any questions that the council may have.
Questions? Mr. Coleman, and followed by Mr. Shuren.
Yeah, I wanted to ask Rob, is there any data on COVID cases in vaccinated people? If so, are there any in Mansfield?
So I don't have it I don't have that information on breakthrough cases at the town level, but generally speaking, I think we're pushing around 30% of cases are breakthrough. I know that about 25 to 30% of hospitalized cases are breakthrough cases. That being said, I think it's important to note that vaccines are still a critically important tool. The unvaccinated are 5 times more likely to contract COVID, develop infection, 12 times more likely to be hospitalized, and 16 times more likely to perish. So vaccines are still an extremely important tool to prevent and reduce the risk of ill health outcomes. On the Yukon population front, as you might imagine, since 98% of the population has been vaccinated, of those, about 1/3 of or actually about 2/3 of those cases that they're experiencing are vaccinated among the Yukon population, which is an interesting number.
Thank you.
I think the governor's report from earlier today said that of the people hospitalized, 77.8% were unvaccinated.
Mm-hmm. Sounds about right.
So it's a little higher than, a little lower. The percentage of breakthrough cases a little lower than 30%. But we're almost 20%.
Right. I'd said about 25%, and he's probably working at more updated information.
Mr. Shuren, followed by Mr. Shaken.
Just a quick question about testing, and this is anecdotal, but I've heard that, or I've experienced, people who are symptomatic have no trouble getting tested, but people who are asymptomatic do have some challenges. How accessible is testing other than home testing for people who are asymptomatic?
So it depends on the provider. I understand that those who are asymptomatic do have some challenges. I think, though, it really depends on how people are filling out the screening form. Because if they're a close contact or in an occupational high-risk setting or in other circumstances which warrant testing, then I think it's important to make sure that the screening form they're filling out includes that information, because that would likely make them eligible for any provider. The other piece of that is that there are providers out there who do asymptomatic testing without pre-screening for eligibility. Yeah. Unfortunately, there aren't as many out there. I do know all the state-sponsored sites. I know that the pharmacies are doing asymptomatic testing. And off the top of my head, there are others, but I'm not sure who they are exactly.
Thank you.
Mr. Shaken?
Thanks, and thanks, Rob, for updating the answers to. I had submitted some questions, and you covered them in your update. I'm heartened to see that we seem slightly ahead of the state average in terms of pediatric vaccines, and but still, I would like to just sort of suggest, and not to suggest that you ought to coordinate this, because I know your office is really busy trying to keep up with the wave, but that the town might think about over the next couple of weeks putting together some forums with local or otherwise experts to help answer questions for people, both who have questions about getting a booster and who have questions about getting their young child vaccinated. just strikes me that with a 35% vaccination rate for young children, there's 40% of people who receive the vaccine themselves, but have for some reason not yet chosen to give it to their child. And there's 60% of people who receive the vaccine who haven't chosen, at least in the state where our average are, we don't know, to get a booster. Anyway, I was at a work conference earlier last week where there was a presentation from the dean of the Yale School of Public Health. And it strikes me that we have lots of very capable medical professionals here in town who work at UConn and otherwise who might be interested in one or a series of virtual forums where parents could hear from them, where people who are thinking about a booster could hear from them and try to do our part convincing folks. I've just sort of noticed, especially on the pediatric front, it seems like government has kind of given up in the convincing part of this equation at the federal and state level. And I think we ought to try locally to do a little bit of it here, especially if we're hearing about cases increasing in our school system. So I know Ryan may be in transit back to his remote location for the remainder of the meeting, but I'll send him a follow-up email. I think it's something that we could work with the school district on and start doing, and maybe other communities will copy us. But that's my idea for the night.
Thank you. Any other, Mr. Bruder?
It's less of a question, more as an observation that my two twins went and got their first dose at the clinic in Coventry, and your office was great in handling it. There were a lot of wonderful volunteers that I either knew through town or knew through work, and it was interesting to see everybody coming together like that and making it a nice environment for them.
Yeah, the kids' clinics are a lot different than the adult clinics. The environment's completely different.
And I definitely support getting out more information for people, for both regarding the booster and the pediatric vaccine, so that they can make the decisions for themselves like that. As for the booster, I know that there's been a number of residents that have told me they weren't aware they were that they qualified yet, and I had to direct them to some of the information either through your website or through the governor's website. And so I think that Ben's got a good idea there. And it's whatever we can do from the town side. I know, again, I'm not trying to saddle your office with more.
Well, we could certainly do our best to support whatever the town decides to do.
Thank you. Any further questions for Mr. Miller? All right. Thank you very much, Rob. And we'll see you. Have a good Christmas or a
You
holiday.
too. Happy holidays, everybody.
Yeah. The next item on our agenda is the release of sanitary sewer easements. The first thing we need to do is have a motion to become the WPCA. Is there such a motion, Mr. Shaken?
I move to recess the town council and reconvene as the Water Pollution Control Authority.
There's second. Seconded by Mr. Bruder. All those in favor, please raise your hand. Okay, it's unanimous. Mr. Carrington, are you the lead on this?
Yes, I am.
I believe Mr. Aylesworth is still in transit or dealing with children, so if you could.
I've just arrived at my destination, but I'm going to make the handoff to John. Thank you.
You're welcome.
So this came to the council last meeting where we set up the public hearing, but this is and we were joined during public comment by the attorney, Mr. Nuff. So this is just the developer needs to remove these easements to do the construction. We got these easements when we first started Four Corners, but they're going to build on top of these easements, and when they put the sewer line, move it into State Route 195, we'll need to release these two easements. So I recommend, the WPCA approve the removal based on the two conditions that the developer submits and applies for the sanitary sewer permit application, and that construction of said line is completed, approved, and operational before the easement is released or removed.
Would somebody like to make this motion? Mr. Bruder? It's on page 149.
Thank you, Mayor. Move to remove the sanitary sewer facility easements on parcels 8.15.9-1 and 8.15.10 upon the following two actions. 1, developer submits and applies for a sanitary sewer permit application, and 2, construction of said line is completed, approved, and operational.
Is there a second? Ms. Berthelot seconds. Further discussion?
And just speaking to the motion, Mayor, I think that Mr. Carrington has fabulously done a well enough job, and that we hopefully can all come and improve this.
Any further discussion? Is there anybody who is going, Mr. Coleman?
Maybe in the packet. Has the town attorney reviewed this?
Yes.
Have an opinion on this?
Yes. It's been reviewed and approved. Any further questions? Is anybody going to vote against this proposal? Is anybody going to abstain? Then I am going to rule that the motion has been adopted unanimously. So, Mr. Neff, you can take the good news home. Thank you very much, everybody. And
this guy needs to go on tonight and firmly entrench himself.
Thank you, Mayor. Merry Christmas.
All right, the next item on the agenda is...
Mayor, you need to come out of WPCA.
Oh, yes. Is there a motion to come out to return Mr. Shaken?
Move to recess the Water Pollution Control Authority and reconvene as the town council.
And Mr. Bruder seconds. Anybody object? Anybody abstain? I rule it's been adopted unanimously. Next item is the appointment of town attorney, and this is a recommendation from personnel. Mr. Shuren.
The Personnel Committee moves that the town retain the firm of O'Malley, Deneen, Leary, Messina, and Oswecki from January 1st, 2022 through November 2023 under the terms indicated in the proposal by the firm.
Mr. Bruder?
Just a clarification. Did we vote? When did their contract expire, or their?
The contract had expired and was extended through December 31st.
Okay, thank you.
We generally, since it is a charter requirement that the town council appoint a town attorney at its first meeting, we usually begin the discussion the first meeting following the election. And usually what we do at that point is extend the existing attorney for a period of time while we decide whether or not to do a search, or we simply renew. But in this case, because of the time since Mr. Deneen had first been retained, we decided to search. The search has been completed. The recommendation is before us. Any questions? Mr. Shuren, would you like to speak to your motion?
We submitted a request for proposals, received 4 proposals, determined to interview 2 of the 4 firms. One firm that we did not interview, there was a potential conflict, and another we felt did not rise to the level of quality, although there were only 2 of us on the committee at that point. We had an extensive interview process and determined that all factors considered, we would continue with the firm of Mr. Deneen.
Is there any further comment on the motion? Any further discussion? Are we ready to vote? Mr. Shaken?
Just a question, Madam Mayor, and I apologize, I can't recall the exact wording of Mr. Sherman's motion, but are we making an official appointment tonight of Kevin as the town attorney, or are we authorizing a contractor? If not the former, do we need to do the former as well?
Mr. Aylesworth.
You would be making a motion to, and unfortunately, I had the motion written and scripted at my desk that I'm not at any longer. But the motion would be to enter into an agreement with Attorney Deneen's law firm for a period beginning January 1st and extending through November 13th, 2023, which is your first meeting following the municipal elections of 2023. And you would be authorizing me as town manager to enter into a multi-year service agreement consistent with the terms outlined in Attorney Deneen's proposal.
I would
we can
accept,
work on a motion in the chat if you want to filibuster while I do that.
yeah, perhaps you could do that, because I did not properly indicate the date, November 13th, 2023, nor did I indicate more specifically the language that I think you're going to be giving us in the chat that will outline these very specific terms of the motion. So perhaps if we could just defer if other people have comments while you're working on that.
And the other element of it that was not in your motion was the authorization of the town manager to negotiate the contract, to sign and negotiate, make the appointment. Mr. Shaken.
So also, my question specifically was, our charter requires the council to appoint a town attorney. It's different than entering into a contract with a vendor or doing an RFP on something else. This is the only two appointments that the council, the two people that we hire are the town manager and the town attorney. And so my procedural question is, do we need to formally by motion, not just authorize Ryan to sign a contract or to negotiate the terms of said contract and then sign it, but to officially appoint Kevin the town attorney?
The answer is yes, and I'm working on the verbiage.
Okay, then I will speak to Kevin's wonderfulness, and if you take longer, maybe he'll hear good things about him from all of us.
He's not on the call.
Well, he'll have to watch the tape. I just say I've been on the town council now for 6 years, and I think I joined in Kevin's maybe second year or first year of representing, or the end of his first term representing the council. I think he's done a good job, as those of you who sat in executive sessions with us over the last year to discuss potential legal strategy will no doubt agree. Kevin provided very level-headed guidance to us at a time of lots of emotion, and I'm very appreciative of that. I think he gives good counsel on a number of issues that come up, even on things that he might feel the answer is pretty obvious, but he's been really responsive over the years when residents have raised concerns to look at them from a legal perspective and give us an opinion on what we can do, and we've been able to take those opinions and form them into what we should do really well, I think. So I'm happy to see the personnel committee agreed, and I'm looking forward to voting for his appointment.
I will say that there have been times when he told us we couldn't do some things that we'd like to do, and also I think his recommendations have been, in answer to Mr. Coleman's earlier comments, extremely non-political, very neutral, legally bound, and helpful to the council. He's got a good sense of humor too. So, Mr. Aylesworth, are we ready yet?
Okay.
All right, so here it is. It's in the chat.
So I will make the motion to appoint the firm of O'Malley, Deneen, Lear, Messina, and Oswecki as the town attorney for the town of Mansfield. No, may I just ask before I continue? We are not appointing the firm as the town attorney, if I'm correct. We're appointing a member of the firm, Mr. Deneen.
You are appointing the firm.
We are appointing the firm as town attorney?
Yeah.
Yes.
Okay, I will continue. as town attorney for the town of Mansfield for a period commencing on January 1st, 2022 and extending through November 13th, 2023. This appointment will be done in accordance with the terms outlined in the proposal submitted by the firm dated October 25th, 2021, and to further authorize the town manager to execute said contract in negotiation with the firm. And that's on behalf of the Personnel Committee.
Okay, so we don't need a second. Any further discussion of this motion? Is there any, Mr. Coleman?
Yes, as I said in executive session, I believe there was another viable candidate, Andrew Crumbie's law firm, a solely black-owned firm. I believe we should have interviewed that candidate, and I cannot support this motion in light of that.
All right, so you are going to vote in the negative?
Yes.
Okay. Any other comment? Are we ready to vote? Okay, who wishes to vote in the negative?
Mr. Coleman.
Are you asking who?
Yeah, I'm asking for negative votes. Who wishes to oppose the motion? Mr. Coleman opposes, and Mr. Frattoni opposes. Is there anybody who wishes to abstain? Is there anybody? I'm going to rule that we have voted with 2 oppositions, 2 negative votes, and 6 positive votes. Everybody else has voted in the affirmative.
Mayor,
Mr. Bruder.
I just thinking about my place of employment, it might be better if I abstain.
And the reason being, where is there a conflict?
His law firm brings cases to our courthouse.
All right, so then we have 1 abstention in Mr. Bruder.
Mayor, may we have a roll call vote? That might.
Yes, we better go through that. It's getting complicated. Ms. Chain, can you do a roll call vote?
Yes, Berthelot.
You're muted, Terry.
Yes. Bruder.
Abstain.
Coleman.
No.
Frattoni.
No.
Kotchenberger.
Yes.
Moran.
Yes.
Shuren.
Yes.
Shagan.
Yes.
Thank you.
Okay. The next item on the agenda is the pedestrian safety concerns and possible improvements for downtown area and country roads. Where'd you go, Ryan? There you are.
I'm here. Yeah. Thank you, Madam Mayor. As all members of the council know, the tail end of last month, our community experienced a tragic loss of life. We had a graduate student, a 29-year-old graduate student, happens to be a Vietnamese national, UConn student, who lost his life crossing 275 South Eagleville Road by the location or intersection with Eastwood, the crosswalk there. And I know the council has been discussing for some time, as well as staff-to-staff communication between town staff and DOT, concerns about that intersection and uncontrolled crosswalks along 275 and in the downtown area more broadly. And so, especially in light of the fact that the council recently met with the director of DPW to talk about pedestrian safety concerns and things that we're doing. In that particular discussion, a lot of it's focused on country roads in our town. We thought this would be a good opportunity to circle back and have a discussion both about safety in the downtown area, pedestrian safety in the downtown area, and perhaps that particular area where the accident happened, but also bring in Sergeant King to the discussion, because Sergeant King, from a police standpoint and enforcement standpoint, was not part of the last discussion. But I did want to also add, before turning things over, first to Mr. Carrington, for the good of the order and for the council's knowledge and awareness, we are working on a joint letter between the town and the University of Connecticut would be signed by Mayor Moran and Interim President Aguinobi, directed to the Commissioner of DOT, specifically asking, imploring immediate action be taken to help hopefully avoid future loss of life, in particular in the area where we just had the accident. And so that letter will hopefully be finalized very soon. I think we all but have it done, and certainly appreciate UConn's willingness to collaborate with us on that, to hopefully really get the message across to DOT that there are dangers here that we want to move fast to address. And it's not just a town problem, it's a University of Connecticut problem. And so with that, I'll turn it over to Mr. Carrington.
Thank you, Town Manager Ryan. And we are looking at all crosswalks since this unfortunate accident. This exact location, the council may recall, we did do a pedestrian improvement on Eastwood Road. So we did address this crossing during that. We did put in a pedestrian ramp at 275. We did put in a stamped concrete or stamped pavement crosswalk similar to the ones you see in downtown. This past summer, the state resurfaced 275. They did not replace that. They put the white stripe crosswalk, which is the standard. If you look at the Federal Highway Association or administration's guide for improving pedestrian safety at uncontrolled crossing locations, and uncontrolled means there's not an intersection where cars stop in all directions and you push a button like in downtown stores at Bolton Road and Route 195 or at South Eagleville and 195. But there are enhancements that can be done in this area. It's tough to do some of them because if we do like a bump out of the pedestrian crossing there, then now bikers that are in the shoulder might hit that bump out. So it's tricky. I think the improvements we can do is to get better lighting at the crosswalk itself. There is lighting on the southern side of Route 275, but there is not lighting at the crosswalk, and we can look at that. Of course, that's going to take some capital investment. We can also look at the rectangular rapid flashing beacon, which if you're familiar with the crossing at the Liberty Bank on 195, we put that crosswalk in 2015 or 2016. And the state's going to put 4 of those on, or replace that one and put 3 others on 195. We had asked about them doing this before, and they said, no, they're not going to do it. We could do it with our money, and they are, about $70,000 for us to put in. So it's not something inexpensive. Don't know if it would have prevented the accident, but we'll never know. We could also look at a pedestrian refuge island, putting something in between, similar. If you're familiar with the crossing right in front of E.O. Smith, there is kind of a refuge island in the middle of that crossing. I don't know all the details of this case, but I don't think that would have mattered in this case, but it would matter for others. And we can work with the state. The problem, it's a state road. They have to approve everything. They did approve this crossing when we did the Eastwood Road sidewalk and improvements there. So they did look at the intersection and really did not change much from what it looked at like prior. As far as I know, that crosswalk's been there for many, many years. And I just want to address that we do a lot for pedestrian safety in town. We have done a lot just since I've been here. We had that Eastwood sidewalk. We have the one that we did on 195 that also goes up Flaherty. We're also looking at Maple Road. Tonight I'm asking for a second portion of Maple Road. Previous director, Lon Holgren, did many bike paths, trails on Hunting Lodge Road. We also have that one that is coming to Hunting Lodge Road and Separatist connection to Maple. So we have done a lot for pedestrian safety. It's hard to do it all because it is expensive. But for those of us that were around UConn like I was 30 years ago, I think there's a lot better pedestrian safety than there was. Can it be improved? Absolutely. And we're willing to do whatever we can to make it better.
Thanks, John. I don't know if Sergeant King, if you're there, I'll turn the floor over to you. Before I do, I just want to make one other addition to the conversation, because it relates more to what John was just talking about. I also should have mentioned in the letter that is being developed, it also expresses the strong belief that the locations of which there are plans for RRFBs, those flashing beacons on Storrs Road in the downtown area that are currently slated for 2023, we're asking that also be moved up in the queue to 2022 to try to get those safety measures installed a year earlier. So obviously we're concerned about 275 as you get close to the intersection with Storrs Road, but also those high car volume traffic locations and high pedestrian foot traffic locations in the area of 195 in the downtown are also of great importance. So Sergeant King, turning it over to you.
All right, Ryan, thank you. Thank you, Madam Mayor, for having us. Listen, I just wanted to second what Mr. Carrington was saying, that even in my 13 years that I've been with the state police, vast majority of that time being here at Troop C and in Mansfield, we've seen a lot of work done to make Mansfield safer for pedestrians, whether it's the walkway over on Hunting Lodge Road or the improvements at 195 and just the downtown area. So I think overall Mansfield does a fantastic job with keeping pedestrians safe, especially with E.O. Smith having open campus as well as the university right there. So prior to coming tonight, I did try to run as many statistics as I could just to get us a general ballpark of where we are. Unfortunately, not able to run anything prior to 2002, just because that's when the state police changed over computer systems from our old systems for Paramus to the new computer-aided dispatch. So from 2002, Mansfield has had a total of 33 fatal accidents. 4 of those were pedestrian involved. Of those 4, one of those was the UConn student who was killed on campus by the fire department. So if you're looking at ones that were actually in state police or Mansfield jurisdiction, there's 3. And only one of those was the most recent one on Route 275. So no other major pedestrian accidents in that particular area. So happy to see that. I will certainly agree that area is, we are seeing some higher speeds, and we're working on trying to do some enforcement in that area, kind of some targeted enforcement. I think everyone that is on the road right now will say that speeds are kind of up statewide or nationwide, kind of as COVID has not necessarily eased, but as things have started to have reopened and people are out and about. So we are doing everything we can as far as any directed enforcement action. Obviously, we're always limited to calls for service and casework that need to come first, but we are out there as often as we can trying to make that happen. So in the research, I can't say that in looking at all our databases that pedestrian safety as far as accident-wise goes has been a big systemic issue in town. Again, unfortunately, since DOT changed the accident report form from our old, you wouldn't know unless you saw it, but a PR1 to what we use now, I'm not actually able to look up the most recent statistics, but I can tell you that from 2002 to 2014, there were 57 total involving pedestrians, which ends up roughly averaging 3 to 4 a year, depending on what year it was, and most of those were minor injuries. So certainly they do occur, it does happen, but I think overall, DPW and DOT are doing everything they can as far as preemptive action, trying to improve the roads, and we do everything we can from an enforcement standpoint, and obviously you will still see us out there. But I do definitely support any improvements we can do over on 275 to prevent something further. We do see a lot of pedestrian traffic that comes from Eastwood over to the Knollwood apartments over at 101 South Eagleville. So it is definitely a spot that's needed. And I think those flashing beacons that have been mentioned before is a perfect fit for that. So I highly recommend that. And happy to answer any questions you have for me.
Thank you,
Ms.
sir.
Berthelot?
Thank you. My first question is there an investigation going as to what caused the accident outside of trying to point fingers at somebody in particular, but instead structurally what the problem is and how it should be resolved? And if there is such an investigation going on, who's doing it?
The police side of the investigation is pretty much causative to what actually occurred. whether it was, the help the accident occur, whether it was all entirely the driver's fault. But as far as the police aspect, we do not actually look into where the roadway would be improved. That's going to be a DOT study. But certainly noted in the accident report would be any issues with lines of sight, whether that's curves or hills. But that's not, as far as the roadway study, that's not completed by the police.
Will DOT do such a study or not?
That is something I have to check with them. I don't have the answer for that, ma'am.
Is that something we can ask for if they're not intending to do such a study?
I would probably defer that question to Mr. Carrington. He might know better than that, but certainly something we can look into.
Thank you.
I'm not aware if they do a study with every pedestrian accident. I know the letter that the mayor and the president are going to sign would, at least at a minimum, I think, get that action. Hopefully we get a response saying what's going to be done. Like I said, our office is looking at it. I don't know if it's our jurisdiction to look at that, but we will look at it. I had a CROG transportation meeting today, and there's a committee called Connecticut Vision Zero Council, because they're concerned that, the pedestrian deaths statewide are up. There was I don't know if anybody saw the news, there was a major accident in Seymour where the Seymour police officer was there telling a couple to cross, and somebody still ran through and hit two elderly people leaving a funeral crossing the street. So something's happening out there with the driving and speed. I'm not sure if that's the case in this case, but it's happening statewide. So they do have a council at that level. So maybe this will get that attention.
Thank you. And I just want to say thank you to both of you for your reports and for all of your hard work. And to weigh in the sense that I think that this is a super important issue, and that it's my experience as a pedestrian that drivers are out of control, and we can't keep blaming pedestrians for being in the wrong place or not wearing a vest or not having a flashlight. I mean, we as a town need to come together and bring as many people as we can to the table to sort of think this through. I recognize that we do have a transportation committee or a traffic committee that maybe we need to change their charge to address pedestrians and make pedestrian safety, but that it may need more than that. But I just want to weigh in that I think this is one death way too many, and I think that every night just driving around town, there are possibilities of far too many people being in jeopardy, and some of it is pedestrians don't necessarily know the rules of the road, but they're much safer if people are driving the speed limit rather than 80 miles an hour on our country roads. Thanks.
Any further comment on this issue? Mr. Shaken.
Thanks. I'd have a couple of questions. One, Sergeant, you mentioned that DOT changed their data system, and so you're not able to look at data in terms of non-fatal accidents since 2014. Is there a way we could access that data a different way? Is it something we could request from DOT? And because it strikes me that we're missing a part of the picture, only looking at fatal accidents.
Yeah, absolutely. As I was trying to look into things today, I was able to pull total number of accidents as well, but I couldn't find a way to search without actually going into each individual one, which ones involved pedestrians or not. So I do actually already have an email out to a DOT contact. I just didn't have that information in time for tonight. So as soon as I have that information, I can look at it a little bit more, and I'll make sure it gets out to you.
Thanks. That would be helpful. I have a memory, and it may not be an accurate one, frankly, because sometimes these things work funnily, where you remember something and it turns out it didn't really happen. But I do remember since 2014, there being a pedestrian involved accident, or maybe a bicycle involved accident at that intersection. It may not have been fatal, but I have a recollection of it happening. And so I think it would help our case to the Department of Transportation, who has denied our requests for that flashing beacon at that intersection in the past, if we could show accidents happening there besides the fatal accident from the other week. So that data would be helpful. And again, these things have a strange way of appearing in one's mind if there's something that is related. So I could be wrong about that, but I just have a memory of something like that happening maybe somewhere in the last 3 or 4 years. My other question has to do with traffic enforcement on non-state roads. We've talked with John, and I think John talked a little bit just now about some traffic calming measures we can look at with some of our artery roads in town that aren't state routes. And I'm just curious if there's sort of official or unofficial sort of state police policy with regard to traffic enforcement on roads that aren't state roads, either as it relates specifically to the resident trooper program or just generally. Is it something that state troopers do in towns without police departments? Is it something that's happening in Mansfield? It's something that could happen here if it's not, that kind of thing?
Yeah, absolutely. There is no policy whatsoever about where you cannot do any sort of enforcement. Certainly in town, I definitely encourage my resident troopers to make their presence known out in the back roads, especially ones that we've received complaints about. I have a list in my office that I keep up to date as complaints come in regarding any sort of traffic behavior that we can try to keep up to date. So when the guys do have time to go out and do proactive enforcement, away from their casework, that they can kind of try to hit those targeted areas. So certainly as a resident trooper level, we do try to direct those to where the complaints come in. From the barracks standpoint, or as far as the Troop C, there's always either Patrol 5 or 6, which either covers Mansfield alone or Mansfield as well as Willington and part of Ashford. I do definitely pass those requests down to the barracks as well. But I can certainly say that, the barracks troopers are a little bit busier, whether they're getting sent all over the place versus being specifically in Mansfield. So when they're trying to get their enforcement in, kind of the habit of behavior, not by any policy, is that, you can get that enforcement done and make your presence known on the state roads. But certainly I do make those requests that when they're able to get on the back roads, especially where we've received those complaints. Referring to your other question earlier, I did remember seeing something about a bicycle accident. I'd have to look up exactly when it was. That usually doesn't qualify as a pedestrian. It gets logged a little bit differently on the DOT forms. The accident forms are made by DOT, so kind of how that we obviously fill them out and do the investigation. But as far as how it's kind of trackable, I will definitely work with them, like I said, to see if I can find better statistics for you on that.
Other questions? Mr. Coleman.
There was a citizen's complaint up near Codfish Falls Road and Chaffeeville Road. I took the liberty of driving up to that site. I was heading northbound, and there was a pedestrian squarely in the southbound lane when I was going northbound. Thank God I was in the right lane. But reviewing the site, there's road improvements and new guardrails, probably replace old wooden guardrails. It appears to me that the town has done everything they can. I think it was a dangerous, narrow road without a shoulder to begin with, and it's still a dangerous, narrow road after the improvements. I noticed the speed limit being 25, and there's a digital sign there as well. I was curious if somebody could answer the question if the digital sign records the speed as you go by. Maybe you can monitor speeds that way. Is that possible?
Yes, it's a great question. That digital sign, that's the one you're talking about?
Yes.
Yeah, the digital sign does record. It sends the information to the cloud. And I know Derek and I were looking at it in the office last week, and I know at like 1 a.m, there was a speed recorded of 67 miles an hour, which is ridiculous.
Yes, that is.
But at least it's 1 a.m, so chance of pedestrian being out there is slim. But sometimes those signs might encourage others to, even though they can look at their speedometer, they like to look at that sign to see how fast they can go. I don't think that happens with many people. It tends to get people to actually slow down. But
what are you finding for speeds in that location on an average?
They're about the speed. They're above the speed limit, but not by much. I can get the exact answer. I don't have it in front of me, but it's. It is. I think it has, except not for that one case I gave you, but for most people, it has got them to realize, hey, this is a speed limit. I got to slow down. They do work, and we're trying to see how we can get more and put them in other places, because every place we put them, we have seen the speed limits kind of dip down from when we put the plates down that people don't really notice and get a count that way.
It looks like it would that road would be a kind of a logistical nightmare to widen or make safer, given the proximity of the Fenton River and the houses. Do you have any ideas how you could make that stretch of road safer?
You hit it. You weren't here when I gave the presentation a month ago, but that was basically it. That one side we got a river and a big drop off. The other side we got people live up pretty steep driveways. In other cases, we have houses that are maybe 10 feet from the road. So to try to widen it and make it safer when it's probably a 300-year-old road that started as an old horse path, or it's difficult. We could do anything with money. Engineers can do anything with money, but it'd be retaining walls and it'd be very expensive to make it happen. So what I have to, and I used to be a runner because of back problems, I don't run anymore. There's certain roads where you have to, even though you want to be out there walking and running, you have to be very vigilant because sometimes the drivers aren't. And I've jumped in pricker bushes and other things many times before and had some choice words for the people who drove by me. And doesn't mean it's right, but that's the reality. And if I had children and I lived on Chafeeville Road, they would not be riding their bikes or walking on that road. Just like there's a road by me here that my children were never allowed to bike or walk on. I wasn't going to have them get hurt because somebody wasn't paying attention.
I think you make a great point on everybody needs to be vigilant. Drivers, pedestrians. I noticed pedestrian traffic has increased tremendously in this town, and I make myself more aware of that fact. I think we all should put to mind on driving safely, not using our cell phones, or participating in Zoom meetings like the mayor did tonight while driving. I think we need to be much more cautious as we travel the roads of Mansfield.
Yeah, that was the first time I've ever done it, and I won't do it again, I promise.
Good gracious, Madam Mayor.
I've seen others of you do it, but maybe the younger you are, the easier it is. But that was the last time. Yeah, I had visions of you all watching me crash into something. Okay. Mr. Carrington, we talked at one point about white lines on the sides of some of these roads. And I wondered if you had been able to follow up on that.
Yes, we could put them down now, but because of the time of year, temperature, weather, it's better to wait for the spring. And there's two trains of thought, and this is even with two UConn professors that are in this field. One will say line striping makes people go faster because it tells them exactly where their lane is, so it's kind of like a track they can follow. And the school I've always been taught is it makes the road narrow, people drive slower. But there is two theories out there and studies that have shown both are right. Sometimes giving people left and right limits makes them drive faster, but it should slow them down. But we will get the white lines painted on Chafeeville this spring.
Oh, that's very good news. Thank you. Thank you. Ms. Berthelot.
So just going forward again, this is something that's very important to me. It seems as if either it's got to be clear going forward where the brain trust is going to be, whether we're going to bring in more community members, whether we're going to charge the traffic committee or whether we're going to appoint another committee to work on this. But it seems like this is a big enough problem. I think it's a big enough problem that we need an action plan. I don't think we have any, I know I have no business trying to tell John or anybody else what to do, but I do think that this is a big enough issue that having a committee of people thinking about it, maybe we can't make things better, but I sure hope we'll try.
Mr. Aylesworth, would you put this down for a future agenda? That is more attention to pedestrian safety and a way of addressing this issue.
Happy to do so. Mr. Carrington and I have talked, I think we were talking about this following the last presentation in terms of, appropriate ways to get stakeholder input in the process without obviously shifting decision-making away from the subject matter experts. But obviously, we want to make sure that the people that are using our roads, that they have a say in how they're being designed and how they're being managed, because that's the public that we serve. So we're happy to put our heads together and maybe next time it's on the agenda, we can have some preliminary recommendations of what that might look like.
Thank you. I think that would be helpful. Mr. Shuren.
Yeah, just briefly, as Mr. Carrington mentioned, there is resident expertise in the town and at the University School of Engineering and elsewhere. Sometimes they conflict, but I think we should take advantage of that as much as we can as well.
Thank you. Any further discussion on this topic? Peter, do you have your hand up?
Yes, just on Ron's point, for example, Norman Garrick, who was in the engineering department, I think is one of the nation's experts on pedestrian safety. I don't know if he worked on the Mansfield downtown plan, but he certainly was involved with it, if not officially a member. And he would certainly be one person to consult on this. It is his specialty.
Mr. Carrington.
On that, he was one of the two professors I was talking about, so we have talked with him before. And also, I believe last time I was in front of you, we talked about the Transportation Advisory Committee rewriting their charge, and I know they don't meet till January, so we'll discuss that at their January meeting. And they only meet quarterly, so maybe that they have to change the meeting times and all. But I welcome input, because I don't want somebody to say it's John made that choice and that's the reason we paved that road, and it's a community choice and how we improve it. I support that 100%.
Thank you. Now, one of the major pedestrian safety measures would be the construction of the sidewalk from the tower's dormitory to Four Corners, and I know that money for that construction was included in the federal infrastructure bill. Has anybody talked with Congressman Courtney's office about getting a hold of that, Ryan? Mr. Aylesworth?
Yeah, so there is actually an update. It came my way after I published the report today, and I didn't feel necessary to reissue the report, but since it's being brought up now, as I understand it, all of the projects that, of which there were 10 that Congressman Courtney's office advanced as part of the transportation infrastructure bill, because as everybody knows, it was a much skinnier version of that bill that got passed. All of the projects in his district, as his staff have told me, got pulled from the funding. However, because there were, promises and assurances made that those projects would see the light of day, Congressman Courtney's office, as I understand it, is working very closely with DOT to find other sources of funding to fund all of those projects. And I was told today that we should feel really confident, really optimistic that we will ultimately get all the funding. It'll just be through a different mechanism. I don't know exactly what those funds are. I'm not sure if it's the state's ARPA money or what, but it sounds like they're willing to stake their claim and their political capital that those projects will ultimately be funded. It just won't be part of the federal transportation and infrastructure bill.
That's a disappointment.
Yeah, I don't want to be a downer. It was late breaking news today, but I guess I choose to focus on the positive, which is they're very confident that the funds will be available, just through a different avenue.
All right, well, we'll wait and see. Anything further on pedestrian safety? Because we're getting late and I would like to move on. All right, the next item on our agenda is all of the new business having to do with bargaining units, both the collective bargaining agreements and also the non-union working conditions, wages and working conditions. So, Mr. Aylesworth, why don't you start with these? And if we can consolidate motions, it would be helpful.
Okay. So as the council is aware, I know Mr. Coleman's a little bit new to the discussion since he just stepped on the council, but on multiple occasions throughout the negotiating process with both the bargaining units for our DPW employees as well as our professional and technical employees, the council was checked in with and provided updates. And so basically I can report that the final terms and conditions in what would be both 3-year successor agreements, everything that the council saw, I believe, and was shared with the council at its meeting on November 22nd. That is what both myself as the authorized party for the town, as well as the executive director of the CSEA has signed off on the final tentative agreements. And so there is no changes from what the council was previously briefed on. And obviously at the last meeting, you signaled your relative comfort and support for what was agreed to at the negotiating table. And so we're just trying to see this through to completion. And the unions were supposed to, or expected, I should say, to ratify the contracts last week. They had to reschedule for various reasons. And so the council is presented with the opportunity to ratify first. That's a little bit different than the usual process, but it's a change in the process that our labor attorney, Ken Weinstock, is comfortable with under the circumstances and trying to get this completed before the end of the calendar year. I would recommend, though, just to make, because I don't know there would be an issue to lump things together, but I would be more comfortable if you did cast separate votes on each of the respective union agreements. I think you can bundle the non-union stuff later, of which there are several, but I would ask that the council vote on each bargaining unit separately.
All right. According to state law, we have 3 choices. We can vote to authorize the town manager to execute the agreements. We can reject the agreements as presented, or to take no action, in which case the agreements become effective without our approval within 30 days, or after a 30-day period following ratification. Generally speaking, because we have been involved with the town proposals all along, we have approved the agreements in the years that I can recall. I don't recall ever rejecting one. I do recall some periods of time when we just I think at some point we may have let one go into effect. As a rule, Mansfield has very good relations with its labor unions. We're cooperative. There have been times when they have agreed to no pay increases based on their real concern with funding issues. These agreements have included a couple of interesting things due to the whole remote work issue has required some additional negotiation. And over time, we have also made very substantial changes in the kind of healthcare proposal we offer. Mansfield has always been a self-funded, I'm going to get the words wrong. We manage our own healthcare system, except that we hire a company to actually do the administration. Mr. Kotchenberger has just indicated that he will have to be leaving the meeting now. So
I apologize, but self-insured.
Self-insured is the word. Thank you. Thank you.
I would be happy to do a half-hour presentation on this, but I'm not going to because I wasn't asked, and it's not my topic area anyway. But good night, everyone, and happy
with bells and whistles, charts and slides, I'm sure. So
good night.
Happy holidays. All right. So would somebody like to make the motion regarding the professional technical union? Mr. Bruder.
This is the one that's on
164.
Thank you. Move effective December 13th, 2021 to authorize the town manager to execute the proposed successor collective bargaining agreement between the town of Mansfield and Local 2001 CSEA Professional and Technical, which agreement shall enter into effect on July 1st, 2021 and expire on June 30th, 2024.
Is there a second? Ms. Berthelot seconds. Mr. Bruder, you want to speak to your motion?
Just to say that I feel like this is in line with what we've approved before, and I think that given all the due diligence that's gone into getting us to this point, I think that it deserves our yes vote.
Anybody else wish to comment on this agreement? Is there anybody who wishes to oppose the motion? Is there anybody who wishes to abstain from the motion? Then I declare that this motion has been adopted unanimously. And the next motion is on page, it's got to be here somewhere.
218?
230.
No, it's on
232.
I'm getting there. All right, 231. Okay, here's the second motion. And this one has to do with Public Works. Would somebody like to make this motion? Mr. Bruder.
Thank you, Mayor. Move effective December 13th, 2021 to authorize the town manager to execute the proposed successor collective bargaining agreement between the town of Mansfield and Local 2001 CSEA Public Works employees, which agreement shall enter into effect on July 1st, 2021 and expire on June 30th, 2024.
Is there a second? Ms. Berthelot seconds. Would you like to speak to your motion?
Again, Mayor, thank you very much for recognizing me. Other than to say that the Public Works employees have done a fabulous job, and the work that's gone into get into this agreement on both sides, I think warrants our approval.
Any further comment? Is there anybody who wishes to vote in the negative? Is there anybody who wishes to abstain? Seeing nobody, I rule that this motion has been adopted unanimously. Thank you very much. Both of these groups have provided really stellar service during the course of the pandemic, and I'm very pleased that we are able to reach agreements that address both the needs of the employees and of the town, and for a 3-year term, which is also really useful. All right, the next item on our agenda is the non-union personal wage benefit and policy updates. Mr. Shuren, I gather this is a motion that comes from personnel?
Yes, the Personnel Committee approved 2 motions, one lumping together several of these specifics, and I'll talk about that, and the other we adopted separately because it involves some retroactivity of wages. Essentially, these resolutions provide to non-union full-time personnel the adjustments, benefits generally, that were approved by the union contracts that we just ratified, that are yet to be ratified, but soon will be by the unions involved. And so let me offer a motion as follows. And I'm going to kind of word it so that it includes the several items. This is from the Personnel Committee. Move effective January 1st, 2022 to endorse the following contingent on final approval by the unions. To endorse Juneteenth as an additional paid holiday for non-union full-time personnel. To endorse an increase to the tuition reimbursement program in the amount of $2,500 annually for non-union personnel. To endorse adding stepmother and stepfather as immediate family members for bereavement leave for non-union personnel. To endorse an increase to the non-union employee health insurance premium for the HDHP HSA to 16%, the PPO contribution remain at 20%. To endorse an increase to the town's contribution to the retiree health insurance for non-union retirees to $270 per month. All of which, as I indicated at the start of the resolution, effective January 1st, 2022, contingent on approval by the unions of the contract before them.
Okay, and this comes from personnel, so it doesn't need a second. Would you like to speak to your motion?
This just maintains the consistency between union and non-union personnel for these many benefit areas.
All right, does anybody else wish to speak to this motion? Is there anybody who wishes to vote in the negative on this motion? Is there anybody who wishes to abstain from this motion? Then I rule that the motion has been adopted unanimously.
I have a second motion.
Go right ahead.
Move effective July 1st, 2021 to endorse a 2.75% general wage increase applied to the town administrator's pay plan, thus affecting compensation for non-union personnel for fiscal year 2021-22, contingent on approval by the unions of the union contracts.
Of the union contract. Anybody wish to speak further on this? Anybody wish to abstain? Does anybody wish to vote in the negative? Then I declare that this motion has been adopted unanimously. All right, the next item also comes from personnel. This is the town manager's annual compensation adjustment.
Yes.
And in addition, the summary report of the performance review.
Yes, the report appears on page 287 of the agenda. The motion from personnel is to increase the town manager's annual salary by 2.75% retroactive to July 1st, 2021, and 2.75% retroactive to November 30th, 2021, for an annual salary of $172,087 as of November 30th, 2021.
All right, comments on this proposal? You wish to speak to your motion, Mr. Shern?
Yes, this is a proposal to, in response to the very favorable review of the town manager, to administer a general wage increase in the amount of 2.75% retroactive to July 1st, 2021, which is consistent to what we're awarding to all non-union personnel, and administering a merit-based wage increase in the amount of 2.75% retroactive to the town manager's one-year anniversary, November 30th, 2021. And this is reflective of the high evaluation we give to the town manager's performance and consistent with what we are providing with other members of the town work staff.
Mr. Coleman.
You're muted.
The performance evaluation, in my opinion, is insufficient, so I cannot support this motion.
Ms. Berthelot.
Thank you, Mayor. I didn't realize until a little while ago that what's in here, this may or may not be what Mr. Coleman is concerned about, but this executive summary is not the performance evaluation. I'm not sure why this is in here, but certainly not what I would have put in here. This was something that happened that was helpful in our evaluation, but to be clear, the actual evaluation was done by the personnel committee, and the entire town council signed off on it. And I want to just reiterate what Mr. Shuren said, that the evaluation was outstanding, and that we're fully supportive of Mr. Aylworth's work here in the town, and that part of this is a merit bump based on his excellent performance. Thank you.
Okay, thank you. I'm going to abstain by insufficient information at the moment.
All right. Does anybody else wish to comment on the proposal to increase Mr. Aylesworth's salary based on the performance evaluation? Ms. Chain, would you call the roll on this?
Yes. Berthelot.
Yes.
Bruder.
Yes.
Coleman.
Abstain.
Bertoni.
Yes.
Kotchenberger. Oh, sorry, he's left. Moran.
Yes.
Shuren.
Yes.
Shaken.
Yes.
Thank you.
All right, Mr. Aylesworth, congratulations. We are really pleased to have you. I think the evaluation is a reflection of your really fine service for the town. And I hope you will be happy here. And I plan to watch your kids graduate from high school and maybe even college. Who knows?
Thank you, Madam Mayor. I just want to say on a personal note, I really appreciate the vote of confidence. And I know I said this when I completed the review process previously, but I also want to say that while I take to heart that there's always more work to be done, and I do appreciate the constructive feedback. I'm certainly not going to be resting on my laurels. One positive review is great, but I look to continue to build on the progress that we've made. Both for me personally, but also as a team. And what I'm able to accomplish, I'm only able to accomplish because I have a great team behind me, and hopefully we can always continue to pull in the same direction. And but I do appreciate the confidence that the council has placed in me to help lead this community and to work with you all. And to echo what you just said, I hope to do that for many, many, many more years to come. So thank you.
Thank you. All right, the next item on our agenda is, oh Lord, come back. WRTD and the local, it's the application for Maple Road. Mr. Carrington, I'm sorry we have kept you so long. I know this is not your favorite night for late night events, but welcome back.
I think John's having flashbacks to the old days.
Yes. At least he can turn off the video most of the time.
Yeah. And the commute's a lot shorter with this remote. Thank you, Madam Mayor. This is a local transportation capital improvement request to CROG. And what we're asking for is to do the second phase of Maple Road, complete street phase 2, which would take us from where we'll complete with the current grant and take us all the way to Mansfield Middle School. Again, making a a bikeway, walkway to keep pedestrians safe. So it would connect our loop around the campus all the way to the middle school. And just asking for approval to apply for the grant. The grant is 100% funded. That's the Lot SIP program. We are responsible for any right-of-way acquisitions, and the estimate, I think it was, I don't have it right in front of me, but it was a low number, and the design will do that in-house. So it's to get $3 million from the feds state to put in a walkway to get us all the way to the middle school, I think is worth applying for. And it's just seeking approval to apply.
Okay, Ms. Berthelot? You're muted.
I'll make the motion if you're ready for it.
Sure, page 322.
Move to approve the submittal of the grant request for Maple Road Complete Street Phase 2, the Capital Region Council of Governments, as a transportation improvement project for funding under the Local Transportation Capital Improvement Program.
Is there a second? Mr. Bruder seconds. Would you like to speak to your motion?
Yes, this seems like a really excellent step forward in keeping our streets and our community safe. So I'm glad we're submitting it, and I certainly hope we get it.
Anybody else wish to comment? Mr. Bruder?
I piggyback on Councilor Berthelot's comments, and then also to just point out, as Mr. Carrington did, it is a fraction of the cost that we would be doing if we did this on our own.
I'd just like to comment that as a person who drives that road occasionally, not infrequently, it is one of the most difficult roads to navigate for drivers when there are pedestrians, and there are often pedestrians. It also has a pretty poor surface. There was some work done on it years ago, but was never properly repaired. So not only is it pretty poor for drivers, but also it's one of those roads that's really treacherous for pedestrians and bikers, and there are a lot of them on it. Are we ready to vote? Is there anybody who wishes to vote in the negative on this proposal? Anybody who wishes to abstain? All right, I declare that the motion has been adopted unanimously. Go for it, John. Good luck.
Thank you. Happy holidays, everyone.
Yes, same to you. All right, now we get to WRTD, and we have received in the chat a note from the WRTD people that they have had to leave the meeting, and we will have to reschedule this for a later, for another council meeting. Mr. Shaken?
Do we need to officially table it, or can we? There's no motion on the floor, so I guess we can just skip it.
I would agree that no action is needed.
Okay. Then let's get to the CDBG CV Helping Hand Program update.
So I'll tee things up for Linda. As the council's aware, we did receive a very substantial grant, about $500,000 through the Small Cities Grant Program about a year ago, and we had 2 years to fully expend the funds that we've been allocated. And as Linda will dive into more details, despite our best efforts of trying to reach all the people that could benefit from this assistance and would qualify for the assistance, we are running into some challenges getting all the money out the door. And so I'll let Linda kind of provide a flyover of everything we've done to date and what the eligible uses of the funding are for, and some of the challenges we've encountered. And then the conversation, we obviously want council feedback, but staff have come up with some possible options or suggestions for how we might move forward and hopefully fully expend the funds by the end of December next year, which is when they have to be spent by. So Linda, the floor is yours.
Good evening, everyone. And just so everyone is aware, we also have Pat Schneider, Director of Human Services this evening, as well as Jolene Woodmansey, a Planner One in my office, who is also our CDBG Grant Coordinator. So you should have all received a status update report as part of your packet. As Ryan mentioned, we had applied for $500,000 in funding back in August of 2020 to do assistance for our residents that were suffering the impacts of the pandemic. We had actually applied for 3 activities, the child care assistance, food and security assistance, as well as rental assistance. However, when the grant was awarded, the state removed the rental assistance portion of the activities because of all of the money that the state had allocated for rental assistance. So at this point, we are just offering childcare and food. And the services that we offer and the assistance that we offer is available to families and households that are at 80% of median income or below. So there is a table in the report that does identify, based on household size, what those qualifying incomes are. And we started back in February with outreach and also launching the child care assistance program. With child care, we can provide up to 6 months of assistance for a family with cost of child care. The maximum amount that a family is eligible to receive is $9,000, and we do have to pay the provider, so that the money does not go to the family directly. We pay their child care provider, and families are required to pay 7% of their gross income to the child care costs, and then we will pay the balance of that. So that is something that we actually saw the most success last summer with summer camp registrations, with families looking for summer childcare when schools were not in session. So we did have families participating. I think most of our childcare assistance was really last summer. We do have a new family that's joined the program that I believe is going to be taking advantage of the assistance for childcare in the coming weeks. For the food program, we do provide food assistance for, again, families and households that meet that income threshold. I will say that per our program rules, in order to receive assistance through either childcare or food, you need to demonstrate that you've been impacted by the COVID-19 pandemic. At this point, we are really looking at it as everyone has been, especially with inflation and the increasing costs of food and commodities. Everyone is experiencing increased expenses. So the documentation needs for that have gone down. You can see in the report that we've done outreach in terms of various mailers, contacting the child care providers to let them know so that they can advise their families. We have also done some outreach most recently with Juniper Hill. So we're looking forward to starting something with them in January with their prepared meal program. And Jolene has also been meeting with the school care teams. So we are trying to get this word out through as many avenues as we possibly can. And to date, we have had 30 households that are participating in the program. And as part of our grant, we had projected 100 households. So we are at about 30%, with 73 people total receiving assistance. I will say that out of those, about 39% are single individual households. So we are seeing a lot of need from individuals as well as families. You can see the income breakdown. The 71% are falling into either the low or extremely low income category. So we are, I think, really seeing the need in the community for this. We are seeing some need for moderate income. I think out of all the applications we received, we had 2 that were denied for ineligibility reasons, and I believe that was due to income. And as we move forward, as Ryan mentioned, what we're trying to do is grow the program, but at the same time confront the various challenges. And we have been adapting as the program has gone on. So initially, if you received assistance from Care for Kids, you could not participate in the program. That has changed. We do have to deduct that assistance from Care for Kids. from what you're eligible to receive so that we're not duplicating benefits, but we can pick up the balance. And there is quite a large gap between what Care for Kids can cover and the cost, the 7% of your gross income in terms of childcare costs. We are also exploring ways to deliver the food program a little bit more efficiently. Currently, what is happening is human services staff are placing grocery orders for family members. They provide us with the order and it is placed by us because we cannot give them cash. We cannot give them a gift card. And those are some of the requests to make it easier, but it's something that we have to give them food under the program rules. We cannot provide cash assistance under this. So that is something that is, as we continue to add more and more households to the program, is very time consuming. So we're currently exploring different ways to provide that food assistance and have drafted a request for proposals from businesses to come in and assist with both prepared meals as well as groceries for families. So as Ryan also mentioned, looking forward and trying to expand the program, one of the concepts that we had was potentially looking at other communities. And that was something the state was very interested in us doing from the beginning of this process. We did hold off with this discussion because we really wanted to focus on Mansfield families and make sure that we were serving that population. But at this point, given where we are in spending, we think it is a question that we wanted to discuss with the council to see if that's something you want to explore at this point moving forward. And the other change that we would like to discuss has to do with very low income families on childcare. So one of the things that we have noticed is that particularly for those extremely low income families, the 7% of gross income towards childcare costs, it can still be a burden. So it doesn't sound like a lot, but when you're at that income level, every dollar counts, and you're trying to pay for food, utilities, housing expenses. And we discussed this with the Department of Housing, and they identified that they did not want us to waive that 7% contribution. However, they were amenable to amending our policies to allow for a waiver on a case-by-case basis when a household or a family can demonstrate a hardship that is really affecting their ability to meet that 7% payment. So those are the two, I would say, key recommendations that we have, or not recommendations so much as items to discuss. And then if the council has any questions, we're happy to answer them.
Council members, Ms. Berthelot?
Thanks. Thanks for your presentation. And this is obviously a super important program that we all want to succeed. Mm-hmm. I guess I'm sorry, it's late and I may be missing what's absolutely clear in front of me. But what are the actual income requirements for families to participate in the program?
So that is on, I apologize, there's no page numbers on the report. So it's actually on page 3 of the attachment under household income. So for example, a family of 4, the highest income a family of 4 could have would be $79,900. And those income levels are changed every year. So we update these. I believe they come out in June of each year. So these are as of June of 2021. For an individual, $55,950 would be the maximum income to participate in the program.
And are those numbers going out to the public?
So we have put those numbers on the mailers that we've done. So we have done townwide mailers, and that income data was on the mailers that we sent out. It is also on the town's website.
And I guess my next question is, I see you've met with the Board of Education. I assume you've met with MAC, Mansfield's Advocate for Children. What are they suggesting what have they suggested that's been successful, and what are they suggesting that might help to get higher enrollment?
So we worked with, so Sarah Dufresne reviewed both the application before we put it out and also helped us with the initial outreach to childcare providers. Some of the feedback that she received, some of it was that they did not have a lot of Mansfield families that met the criteria. So that was, and they did ask if we would consider opening it up to other communities because they had families from other communities that needed it. One of the things that we are still struggling with is the application itself and the documentation that families need to provide is being seen as a barrier. And so that's something where I know Jolene has helped folks both in the office as well as gone out to their homes if they do not have transportation to assist them in filling out the application. So it's something we keep trying to simplify it, but in terms of our requirements from a federal perspective of making sure that households meet the income requirements and that we're checking that we have that documentation for monitoring purposes is a challenge. And I will say, I think of the number of applications compared to the number of families participating, a lot of that is actually due not so much to application denial as it is that we simply have not received the documentation. So the application itself is online. You can fill it out online and hit submit. In order to complete that process, you need to get us the income documentation. And those are the proof of residency in Mansfield. And that's the documentation that we're not receiving. And we do follow-up emails. And in some cases, folks have withdrawn because their circumstances have changed. And others, it's just too much for them at that point in time.
Are we offering to just sit down with people and help them fill out the applications?
We do. If they call us, and I believe Jolene's on the line and can answer this better than I can, but I know Jolene has done it. Again, she has met with folks in her office and done the application with them, as well as gone out to homes and filled out the application in clients' homes.
Are the applications in languages other than English?
Not presently. We did send out a mailer indicating we had assistance and translation services available for Spanish, Chinese, Korean, and Arabic. We can also do other languages. So we are utilizing the state contract, but we have not had anyone at this point where they've indicated language has been a barrier.
Are we advertising in other languages?
That was the mailer that we did. So the mailer that we did we did not do the entire mailer, but we had food and childcare assistance and translation and interpretation services available were the two phrases that were translated into Spanish, Korean, Chinese, and Arabic.
Thanks.
Anybody else? Let's take a look at the proposals. At the very bottom of the submission. I think what Linda needs what Ms. Painter needs from us is authorization to make these changes. Mr. Shakin?
Well, I don't think she needs a vote, but some feedback is what it looks like they're calling for, and I think all of these three ideas make a lot of sense, and we ought to. That's my feedback, that we should move forward with them. I think the regional approach to the funding is totally fine, and while those communities certainly had an opportunity to apply for this funding as well, and some of them may have it. We got a lot of it and we need to spend it, and it's not doing anybody any good sitting in the bank. So if there's an opportunity for our neighbors and other communities to take advantage of some of it, then I think we ought to explore it as well as the other two options that were given. So I think they're great ideas.
Ms. Berthelot?
I would echo what Mr. Shakin said, and also maybe add the caveat that our first focus in terms of spending for families for other communities would be the families that are utilizing the various daycare programs in our town, that would be a good place for outreach from those facilities.
And including in that E.O. Smith. Any other comments or questions? I'm getting a sense that there is no objection from the council to doing whatever you need to do to get this money in the hands of people who need it.
Well, we will continue to adapt the program as we need to. I will note that we will be holding a public hearing. That is a grant requirement that we have to wait at least 1 year from the time that we started to hold a public hearing. We did talk with our representative from the Department of Housing from a technical legal standpoint that we're not supposed to do that until a year after the assistance agreement is signed, which would put that hearing, I believe, in September, Jolene, with the funding due to expire in December. And so we did talk to him and indicate that since we really started providing the services in February, we thought it would be better to have that public hearing in March, where if we get feedback, we can actually try and make adjustments in response to that feedback. Whereas if we do it in September of 2022, there's not a lot of time for us to shift direction if we need to.
Just out of curiosity, have you talked with Access Agency or with United Services or any of the major social service providers in this region?
I don't think Jillian or I have. I would defer to Pat in terms of whether her staff has had any contact with them.
I can say that we have shared information. In fact, I actually spoke with the executive director of Community Companions and Homemakers today about it, as you know, she had some interest in not only serving Mansfield residents, but certainly if it opens up to client, people households outside of the area. So yeah, there has been. We haven't done a massive marketing only to some of those agencies, only because it wasn't open regionally. So, and sometimes there's a misunderstanding and we can get flooded with people who aren't eligible, who are not from the town. So we've been very careful in how we've passed that information on to some of the regional agencies, just so that they don't misunderstand and then have Jolene inundated with people who are at least at that until this meeting, and we decided to move it to regional. We're not eligible, but I think that that's a great idea to expand that information sharing a lot further. I also spoke with the executive director of WAME, and again, because they do a lot with food insecurity in the area regionally as well, and some of the director of the Woolwich Shelter in Willimantic, who has Mansfield families or people who move into Mansfield. So kind of more on an informal basis, but not a, out kind of a wide distribution.
And I will say that as we expand the program, we are also looking for assistance to help us with the qualification process, because that is something that is time consuming, and staff is just, we're reaching our capacity limits on this, particularly Jolene, since she's been doing all of the income qualifications and tracking down documents. So we are looking for some assistance on that, and do have a request for proposals out for someone to come in and help us with that portion of the project as well.
Can we spend that money on that person from the grant?
Mm-hmm. Yes. Those are eligible expenses from the grant. Yes. We at this point, I think you can see from the breakdown of the funding, through the first year, we have spent approximately $8,000. And I will say most of that is either staff time, and that's literally human services staff time and ordering food for people. So it was additional hours. So it was over 35 hours a week for that individual. So the 35 to 40 hours a week, we're charging that 5 hours to the grant. But if she goes over those 5 hours, that's something I think it is taking more time, Pat, now for Dorothy than the 5 hours a week we'd initially allocated. The other costs that are in there were outreach. So those were the mailers that we talked about, the printing and the postage, as well as, quite frankly, the 2,400, 2,500 roughly under program administration was mostly advertising for the professional assistants. So the advertisements that we need to run are lengthy and expensive. We do run them in multiple newspapers, including minority newspapers in the state, to really get the word out that there are opportunities for work in this area.
All right. Any further comment or questions? As usual, this is a very well prepared, presented program. I do think you've got the support of the council behind you, so go forth and give out money. It's clearly, when we have 30% of our school kids on reduced lunch, we have people in our community who are in need of support and help, and if we can do that, we should. And I understand that almost every student in Windham is on some kind of reduced lunch as well. So there are people in our immediate community, if not just in Mansfield, who really need support and help. And if we can use this federal and state money to do that, we should.
All right.
All right. Well, thank you for hanging in with us so long and so late. And we'll look forward to hearing what the results of this exploration are.
All right. Thank you very much.
All right. Reports of council committees. Finance, Mr. Aylesworth.
I know if you wanted me to.
I'm sorry. Your manager's report. I'm sorry.
I will try to be brief in the interest of time because it is quite late. So just maybe flag a few items that are otherwise in my written report. The Local Government Academy is rounding out its last two sessions. It has a session on human services and then a wrap-up session that'll also delve into appointed boards and committees. There'll be a little bit of a jump ahead in terms of the last session because of the holiday time frame, so we'll be finishing up in January. But that program continues to go very well. I've been really, really impressed by the caliber of the presentations that our department head team has given and continue to get really positive feedback from participants. So I think it's definitely a program that will be here to stay and hopefully become an annual tradition. Myself and Charmaine and other related staff are in the process of finalizing the FY22 budget guidance. We have an official kickoff meeting for the FY22 budget with staff a week from today. And so the budget process will effectively begin in earnest at that time. And it'll be a very busy next few months, I'm sure, between now and early April when recommendations come from my office to the council. I did want to mention, I know that we put out a general sort of alert to the council, and I'm sure everybody's aware from the reporting, but I did want to obviously make mention of the recent approved land transfer Yukon to Office of Policy and Management for the purpose of having the old Bergen Correctional Institution site or a portion of it become the future home of a new Windham Tech, state-of-the-art, state-run school. I know there's a lot of thought and frankly empathy being extended to Windham in terms of the impact it may have on Windham as a community if the tech or when the tech school moves to the new location, and wanting to be mindful of that. But it's certainly something that from a standpoint of the future development of the Yukon Depot campus, one can speculate that this action isn't happening in a vacuum and that perhaps there will be more information coming out of Yukon in the near future about what may be happening on the Depot campus in light of the fact that at some point in the future, some years from now, obviously, there will be a new tech school across the street. And I'm sure there'll be a lot of efforts being made to tie in and integrate what's going on at UConn with the tech school across the street. The search for a new superintendent continues. I believe, Madam Mayor, you and I didn't really talk about it, but I assume contact was made with you just as it was made with me. Yep. The search firm, Cooperative Educational Services, which has been, I think, doing a pretty admirable job trying to get community input, stakeholder input in the selection process for a new superintendent. And that's happening in a variety of formats, focus groups, in-person interviews, surveys. But they're moving forward. The Board of Ed is moving forward with an ambitious timeline to try to have a new superintendent named during the month of February. Given that applications are still being received, as I understand it, until December 20th, that is an ambitious timeframe. But I'm sure we'll continue to get updates along the way. Progress obviously continues to be made on the new elementary school, and I just really wanted to point out something I thought was a great addition, a great thought that the board had to help commemorate this whole process by doing a beam signing ceremony. I know at least a couple kids in the school system that got a chance to participate in that and are still talking about it. They love the idea of their names existing on in perpetuity on one of the beams that's actually incorporated into the school. So that's great. It certainly helps build a sense of shared ownership and connection to the new school even before the doors are open. And, you know, as those of us with young kids can attest, sometimes it's hard for kids to say goodbye to something. And I know, although our kids won't have been in the school in Southeast Elementary School for, you know, more than about a year and a half by the time it closes its doors, I know there's going to be some misty eyes in our household making that transition. So every little bit can help, you know, build that sense of community and excitement around the new school. And there certainly is a lot to be excited about there. So just a couple other items. I did want to point out that we are trying to increase our marketing, as it were, for the Affordable Housing Committee. Hopefully we'll get more people coming forward that are interested in serving on the Affordable Housing Committee. As you all know, because you approved the ordinance and established the committee, you know, we are trying to draw from a variety of backgrounds and interests and expertise. You know, real estate, property development, finance and accounting, and amongst others. And of course, we also want to do everything we can to encourage those that are, you know, residents or consumers of affordable housing to come forward too, because they understand the needs as well as anybody could. And so we certainly hope that we're able to make some inroads into those communities and attract some people to come forward. Maybe just to end with a couple notes on facilities. I know there's been interest in the status of the electric vehicle chargers in the Nash Zimmer Transportation Center. As I think most members of the council know, for some period of time, all four chargers, which are units you have to pay to use, those aren't free like some of our other locations, the ones in the parking garage, those have been down, and we've been struggling to try to keep them online and operational, get them up and running for a little while, and then they're right back down again. So I asked facilities just to go ahead and put some temporary units in there. They don't charge, they don't assess a fee, I should say, for the charge that somebody gets. But we've replaced two already, and we're putting two others in now. These will eventually be rehomed. They'll be put in places where we want to have charging stations, but we don't necessarily anticipate assessing a fee for it. So when I say they're temporary, they're not temporary in the sense that we'll purchase them and then have no use for them. They're temporary in the sense they'll only be in the parking garage on a temporary basis until we figure out a permanent solution. But certainly, you know, the values of the town being what they are and a commitment to net zero and green energy, the last thing anybody wants is for a driver of an EV to come into the garage and find that they can't find a place to charge their car and have a less than, you know, favorable impression of the town's commitment to renewable energy and to electric vehicles. So so hopefully, you know, what we have in place will be a good lasting solution until we have a truly permanent solution in there, and as we work to expand electric vehicle stations throughout town more generally. Also want to point out that the middle school roof replacement project is about 60% completed. as the mayor knows, because she was on the same meeting as I was last week, there are some concerns about timeline and holdup, and I know we have project managers and engineers that are working closely with the contractors and subcontractors to make sure the project gets done as expeditiously as possible. But the timeline does seem to be lengthening, and we're just going to have to keep monitoring that, because also, the second piece of that, second phase of that is, as the council knows, is the roof-mounted solar array that'll go in, and none of that can obviously happen until the roof replacement piece is done. And then also on that same theme of solar power and renewable energy, we just issued an RFP for town solar projects. We're looking to see what interest exists in the market for a variety of town sites and buildings. One possible location, of course, being the old landfill, basically the transfer station site. Incentives seem to be improving, so there might be more interest in moving forward with a project like that now than there was in the past. And so I think I will end it there. And unless there are questions that the council has.
Questions for Mr. Aylesworth? Nope. Once again, you've left us speechless.
I think you're all just exhausted.
That's also possibly true. And then, of course, the complete report is available in your email and online on the town's website. Okay, then let's move to council committees. Mr. Shaken, are you making the report for finance?
I am. Finance committee met this evening before our meeting at 6. We had a few items on our agenda. You approved the quarterly financial statements earlier tonight, which was one of them. The other one is that we received the much anticipated report from the Parks and Rec department about the future of the Silver Sneakers program and about the impact that COVID has had on the Mansfield Community Center. Both are important. I won't spend a lot of time on the details, only to know that we sort of received that report but ran out of time before this meeting started. And so we are planning to have a special meeting in January that's scheduled not for right before the council, where we can delve into those details and recommendations and come up with something to recommend to the council. And as always, all of you are invited to attend that meeting when it is scheduled. So I think the things are stabilizing is how I would classify the data that we received tonight. But they are stabilizing at a reality that is much lower, as you could imagine, than pre-COVID utilization of the community center. And so the big question is what happens next. And frankly, that's a question much bigger than revenue at our local community center. It has to do with people's comfort being in interior spaces with other people in general. And it's a question I'm sure many people in the restaurant business and elsewhere are asking themselves, just as we are in the community center. And so the recommendations are to sort of hold steady. The shorter version of this is to sort of hold steady for right now, and wait until COVID stabilizes and we can make a sort of accurate prediction of where things go in the future. And then there's some further recommendations related to the future of the Silver Sneakers program and other revenue issues with the community center that we'll be diving into more detail about.
Any questions for Mr. Shaken? I just wanted to comment that part of Mr. Aylesworth's report is that he's currently second round of interviews for Parks and Rec department head.
That's correct. Jay O'Keefe has been serving as the acting director for over a year, but we did open up the search for a permanent replacement, and so that's one sort of piece, I guess, of uncertainty that's been hanging out there, and I think we'll all feel better once that sort of search process is done and we know we have a permanent director moving forward.
Thank you. Mr. Shuren, is there anything else from personnel?
No, as the matters that we dealt with at our meeting this evening were all dealt with by the council.
Okay, and Mr. Bruder, Committee on Committees.
Thank you, Mayor. We met this past Thursday and had a number of great applicants for that Affordable Housing Committee that our town manager mentioned, and I really appreciate all the work he's doing to drum up applications. We did submit a request to the Board of Ethics regarding any conflicts of interest, specifically with the Mansfield Housing Authority, and look forward to having a vote on getting that started in the near future.
Okay, any questions for Mr. Bruder? All right, any comments on departmental and advisory committee reports? Any comments on petitions, requests, and communications? Any items for future agenda? And of course, we did make one request, and that is a continuation on pedestrian safety. Then there's only one item left. And before we get there, I just want to say that we had a really lovely holiday celebration. And thank you very much, all of you who participated in it. I measured the success of this event by the noise level. You guys were pretty noisy. So I assume that meant there were lots of good conversations going on. Anyway, okay, next item of business is a motion to adjourn. Does somebody want to make it? Mr. Coleman moves to adjourn. Is there a second? Seconded by Mr. Bruder. All those in favor of adjourning, wave your hands. Good night, everybody. Happy holidays, all. Happy holidays.
Recording stopped.